You're watching KFDM News tonight at 10.
Thanks for joining along tonight. We have alarming numbers to share with you that the opioid epidemic could be making its way into Southeast Texas.
Opioids are a class of drugs that range from heroin to prescription painkillers. Opioid addiction has been described as a national health crisis, but it seems Southeast Texas was immune. KFDM's Angel San Juan joins us to investigate and explain why that may no longer be the case. Angel?
Jefferson County Sheriff Zena Stevens tells us what's raising the red flag about opioid use in our community is the number of inmates booked into the jail high on opioids. Sheriff Stevens says 20 to 30 of them a month are having to go through detox at the correctional facility. What's happening behind this barbed wire fencing is bringing to the forefront what could turn into a looming crisis in Southeast Texas. Opioid addiction. Jefferson County Sheriff Zena Stevens says it's not yet evident to her narcotics officers on the streets.
They're saying that they're not working a bunch of those cases.
But Jefferson County jail records tell a different tale. Sheriff Stevens says an average of 20 to 30 people a month who are booked in are high on opioids. They include heroin, synthetic opioids such as fentanyl, and pain relievers available legally by prescription.
And we immediately start with our medical staff a detox program to get them in a safe, out of crisis.
And they're not usually brought to the jail because of drug charges.
Other crimes, and we're having to detox them to accept them in our facility.
But it's making law enforcement aware of a problem that many thought was part of our past in Southeast Texas.
I do believe that the local crackdown with the police departments and the sheriff's office and the district attorney's office cracking down on those pill mills, I think it did have an effect. But that's been a few years now.
And in that time, the opioid epidemic spread throughout parts of the United States, becoming a national health crisis, with Texas avoiding the brunt of it. Still, based on the inmates she's seeing, Sheriff Stevens is concerned about what may be down the road.
It's a problem. When I talk to you about 20 to 30 people being booked in a month that we're having a detox, it's a problem. How it manifests itself, is it something that's affecting our community at a slower rate than in other communities in the country? Possibly. I still think that we got to pay attention.
Sheriff Stevens says cultural and geographic factors usually determine a person's drug of choice. She says here in Southeast Texas, cocaine, meth, and marijuana are the most prevalent illegal drugs. Greg?